Today is Washington, D.C.'s first day of school for children. We previously told you about a mandate that would have kept any student who wasn't vaccinated from attending. But yesterday, Deputy Mayor for Education, Paul Kine, announced that the vaccine mandate will be pushed back until January 2023. D.C. Mayor Muriel Bowser faced major backlash over the vaccine policy. According to associate editor at Reason magazine, Liz Wolfe, more than 40% of Black teens in the city would have been kept from attending school. In addition to proof of vaccination, students of all ages are required to provide a negative COVID test before stepping foot into the classroom for their first day.
A statement by Mayor Bowser said on the issue, in part, we're not offering remote learning for children, and families will need to comply with what is necessary to come to school. It's a move that prompted the NAACP to get involved.
The numbers are pretty striking. The Washington Post reports 87% of white children 12 to 15 have been vaccinated, while just 53% of Black children. Are you planning to sue or take some other measure to try to stop this mandate?
Not at all. We are not looking at any legal action, but we are, as you know, the NAACP is the nation's oldest and largest civil rights organization that for over 112 years has been a fierce advocate to ensure that Black lives are valued, safe, healthy, and whole. And the challenge within this mandate is to balance both public health and educational equity. So ensuring that we are that voice to fight for educational options for all students, but particularly because these numbers show that the unvaccinated population is particularly disproportionately impacting our Black students, we must fight for quality alternatives to ensure that no students are left behind.
My colleague, Reason's Liz Wolfe, joins us now to unpack all of this. Thanks for being with us, Liz.
Thanks for having me.
Yeah, so they at the last minute delayed enforcement of the vaccine mandate until January, which I always find funny when they change it at the very last minute. Like, what was the situation for families and parents? Were like, okay, well, my kid's not going to school. And then at the very last minute, they maybe find out that actually your kid can go to school, and so they send him to school. Probably a lot of those people, it's too late. They're not going to school anyway because of, bad public education about this issue, right?
Well, yeah, I mean, it's such an interesting political topic, right? Because Fox News and the NAACP are on the same side, right? Mm-hmm. Which isn't to say that that never happens, but I think it goes to show that you could have a principled objection to vaccine mandates of this sort and also be concerned about the racially disparate impact that these things end up having, which is something that so many progressives claim to care about. Muriel Bowser's own administration has claimed to care about this and yet still felt comfortable imposing this from on high. It's worth noting, with public schools, we've long had vaccine mandates in place. We expect public school children in this country to be vaccinated against measles. We expect them to be vaccinated against polio. But it's worth considering, does COVID rise to that level? We see vaccines being highly protective against death and severe illness, but not against actually contracting infections. We see tons and tons of breakthrough infections. And so if the goal is ensuring that there's not an outbreak that's disruptive to school, I think it's a little bit of an open question as to whether vaccination actually achieves that. So I think there should be a very, very high burden of proof and of efficacy that we impose. I think we should be as sparing as possible with the mandates that we're going to pass down for public school children. And yet, for some reason, Bowser hasn't, felt comfortable doing that. She's decided to be sort of a culture warrior about this.
You often can't get, these days, you can't get progressives to care about a policy issue unless you frame it in terms of racial inequity. Like, that is the lens through which so many progressives and Democrats approach all policy questions. I mean, the ACLU has to, when it's discussing abortion, has to say, how this will affect the LGBTQ community, because, that's just what progressive circles do now. So thus, you would think, you might expect an actual racially disproportionate impact from this policy would be something of great interest to the ACLU. And even though they were, on the same page as Fox, the NAACP there, it was interesting they said, no, we're definitely not going to sue. What is this this deference to a public health policy that I don't think you can even justify really on public health grounds anymore, that they're not, well, we're not going to sue over it. Would that be, in any other situation, would they not sue over something that had a racial inequity component?
Yeah, I think that's a really good point, and it just points to the degree to which this is a very tribal, very partisan issue. But I do also think we need to, as libertarians who cover this type of thing frequently, we need to go back to the fundamental thing, which is like, what's the enforcement mechanism for this? Basically, these kids could become truants if they're unable to attend school because they're unvaccinated. That means then the city can go after them for truancy-related issues. Okay, well, at Reason, we've long covered all kinds of situations where child welfare service and social services agencies intervene and start surveilling parents, and in some cases, even go so far as to, trot those parents into court or levying fines, or even in very rare cases, subjecting them to jail time or putting them on offender registries for child abuse and neglect. I mean, we saw a case recently in New Jersey where a mom who'd left her kids in the car for, to run a quick errand, to go into a store to, I think, grab some sort of dessert for after dinner. She left her 3-year-old and her 5-year-old in the car, and she ended up terribly surveilled by the state for years to come because of this. Robbie, you recently covered that Arizona case where a mom had left her kids in a playground in a park near an acquaintance who was teaching an outdoor class to run into a grocery store to get a turkey. And by the time she came out of the grocery store, the cops had started questioning her, and now she's barred from working with children in the state of Arizona. It's despicable, and we need to have a really, really, really high standard for when we involve child services and child protective agencies.
In fact, a DC judge has also ruled that the mayor's 2021 city employee mandate is unlawful, per your remarks, Liz. That mandate required all employees to provide proof of vaccination in order to work in the district. According to WUSA 9 in court documents, Superior Judge Morris Ross said that the mayor, quote, lacked the authority to impose the vaccine mandate through emergency executive order. So it does seem like the sort of, the tide is turning at some level. And yet when it comes to the most vulnerable, one of the most important things, which is keeping Black kids in school so they can get a good education, have access to the American dream, Mayor Bowser's on the wrong side of this.
Oh, absolutely. And I think we're seeing this really interesting dynamic where it's sometimes the richest residents in some cities that are pushing back against this. But it's a good thing they are, because I think that actually ends up helping poor minority students who would otherwise get in trouble, possibly for truancy. We saw this happening in LA when LA's sort of public health head honcho, Barbara Ferrer, was trying to impose a mask mandate because LA's case counts were rising this summer. And a bunch of residents of Beverly Hills said, nope, we're not going to be enforcing that. You can do what you want, but we, the fine people of Beverly Hills, will not, in fact, be adhering to that. And I think there's a really interesting situation right now that we're seeing where these public health authorities have gotten used to exercising their powers. But 30 months into this pandemic, a whole bunch of people are saying no. And I think it's really good for people in all positions to basically defy, because I think that ends up helping those Black students who really do need to be in school, who would otherwise get in trouble for truancy and have their parents sent to court and harassed by the state or harassed by the city.
It's interesting, too, Mayor Bowser, when she was asked about this issue at a press conference, I think the last week or the week before, by Doug Blair, who's a friend of mine who works at the Heritage Foundation, and she was like, well, I don't know about those numbers. I mean, they're numbers that are reported by the Washington Post. You'd think there'd be a lot of, jumping down her throat about misinformation, about, impugning the media's good judgment or something, but alas, no, I haven't seen a lot of criticism except from, very right-wing people.
Yeah, I mean, the fact of the matter is it's a blessing that COVID isn't super deadly for kids. We have 70 million children in this country. We've had significantly fewer than 2,000 deaths in kids. We're getting better and better at treating kids, even though I don't think Paxlovid is technically approved for the youngest demographic. I know they're running a bunch of clinical trials to sort of study and see how effective it is. We're getting so much better at fighting this thing. Obviously, if you are concerned about your kids getting sick and dying, you should get them vaccinated. But I think it's important to recognize that this is something that is, generally speaking, not impacting kids too much. And that's a really good thing. We're really lucky.
And is not, unfortunately, I wish it was not the case, but that the vaccination is not keeping down transmission. So then the justification for, requiring kids to get vaccinated the way you had, like you were alluding to, Liz, with other vaccines, because, well, you don't want outbreaks in the classroom. Like, look, you might have outbreaks in the classroom, but whether you of COVID and whether you're going to have them or not really isn't dependent on whether you have everybody vaccinated or not. Like, no one is claiming otherwise now. Even the most pro restrictions kind of COVID voices, they agree. We're not holding down transmission via vaccination. So having that policy just doesn't seem to make a lot of sense. And then it's going to have harm. It's not going to have good in terms of a public health benefit. Maybe it has some benefit for individuals, although even at this age group, it's hard to see real strong positive outcomes because, like you said, it's a population that thankfully does not experience disproportionately bad COVID outcomes. So Liz, thank you so much for joining us today. We really appreciate it.
Thanks for having me.
And we'll have more Rising right after this.